Chapter 1 Episode 27. You may know your blood pressure. You may know your cholesterol, or A1C. But do you know your SpO₂, your blood oxygen saturation? If you've ever had a little device clipped onto your finger at a doctor's office or hospital, you've probably already had it measured. But what does a reading like 98% actually mean? SpO₂ stands for peripheral oxygen saturation. Your red blood cells contain hemoglobin, which carries oxygen from your lungs throughout your body. A reading of 98% means approximately 98% of the available oxygen binding sites on your hemoglobin are carrying oxygen. In simple language, SpO₂ helps tell us whether oxygen is getting from our lungs into our blood. Measuring SpO₂ is remarkably easy. A small device called a pulse oximeter clips onto your fingertip and uses light to estimate the oxygen saturation in your blood. There's no needle and no blood draw. Within seconds, you'll usually see two numbers. SpO₂ is your estimated oxygen saturation. PR, or pulse rate, tells you how many times your heart is beating per minute. If you want to measure SpO₂ at home, fingertip pulse oximeters are widely available. You can find them at pharmacies, medical device suppliers, major retailers, and online. In Canada, many basic fingertip models cost approximately 30 to 60 Canadian dollars. But accuracy can vary between devices, so don't simply choose the cheapest unknown model. Health Canada recommends checking whether the device is licensed for sale in Canada. Now let's look at the number. For a generally healthy adult at sea level or modest altitude, resting SpO₂ is commonly around 95 to 100%. If you see 92 to 94%, make sure you're measuring correctly, repeat the reading, and consider your symptoms and your usual level. Repeated readings in the low 90s deserve medical attention, particularly if you feel unwell. Around 90% or below can be serious and may require urgent medical assessment. However, these aren't universal diagnostic cutoffs. People with certain chronic lung conditions, or those living at higher altitudes, may have different usual levels or targets. Does everyone need to buy a pulse oximeter and check SpO₂ every morning? No. Most healthy people without heart or lung disease don't need routine daily monitoring. But home monitoring can be useful during certain respiratory illnesses, for people with known heart or lung conditions, or when a healthcare professional recommends it. The goal isn't to become obsessed with another number. It's to recognize when something is different from your normal pattern. Suppose your SpO₂ suddenly reads 92%, but you feel completely normal. Don't immediately assume something is wrong with your lungs. Cold fingers, movement, poor circulation, nail products, improper placement, and device accuracy can affect the reading. Warm your hands, sit quietly, place the device correctly, and wait for the number to stabilize. Then check again. If the reading remains unusually low, especially if you have symptoms, contact a healthcare professional. This may be the most important lesson today. A normal SpO₂ does not prove that your lungs are completely healthy. Someone can have asthma or early lung disease and still have an oxygen saturation of 98% while resting. Even someone with early lung cancer may have normal oxygen saturation. SpO₂ measures oxygen saturation. It doesn't test every aspect of lung health, and it is not a lung cancer screening test. And never let a normal-looking SpO₂ reading stop you from seeking help if something feels seriously wrong. Severe difficulty breathing, chest pain, confusion, blue or gray lips or face, or rapidly worsening symptoms require urgent medical attention. Remember this simple rule: don't just watch the number. Watch the person. Now we know what that little SpO₂ number means. But what if your oxygen level is 98% and you still keep coughing? Maybe you cough every fall. Maybe it happens around cats or dogs. Maybe you're coughing while cooking. Or perhaps you've been coughing for weeks and don't know why. Sometimes the most useful question isn't simply, do you cough? It's, when and where do you cough? That's what we'll investigate in our next episode.